Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association, or APDA. I am so pleased you are joining our conversation today about the National Plan to End Parkinson's Act. This is the first ever federal legislation dedicated to the prevention and cure of Parkinson's disease, which is expected to be signed into law by the President any moment now. Before we begin, I'd like to take this opportunity to thank all of you who answered our call to step up and help our elected officials and policymakers understand how critical this legislation is for the PD community. This was such a team effort, and we are so grateful for your participation. We know you have a lot of questions about this act, so we have invited a special guest to join us today to help us understand the details of this legislation. Ted Thompson is the Senior Vice President of Public Policy at the Michael J. Fox Foundation, who led the advocacy team that was instrumental in getting this bill passed. Ted has more than 30 years of experience in public policy and government affairs, serving in several nonprofit leadership positions, and as well as serving on the staff for 2 members of Congress. Ted also helped create the Unified Parkinson's Advocacy Council, or UPAC, of which APDA is a member. So let's bring Ted to the screen to share the latest updates on the status of this new law and explain why it's so important. Welcome, Ted.
Thanks, Leslie. Great to be here, and I appreciate the partnership with APDA through the years. You've been an important partner in advocating around public policy issues, and you mentioned UPAC. That's a broad-based effort to draw in as many Parkinson's and Parkinsonism's organizations as possible, so that on policy issues, we're speaking with one voice. And a prime example of what that will get us is the National Plan to End Parkinson's Act.
It's great to have you here, and we are really looking forward to your comments. So thank you so much. Okay. To make sure we cover the questions that are most important to all of you, we gathered your questions ahead of time during the registration process, so we will not be taking questions live from the chat today. However, please say hello and tell us where you're joining us from and share your comments. We'd love to hear from our audience. So Ted, let's start with our very first question. Can you please give us a brief overview of the National Plan to End PD and the significance of it for our community?
Absolutely. And I will state at the outset that this was not my original idea. I saw what was working really well for the Alzheimer's community and thought, you know what, we're the second fastest growing neurodegenerative disease in the world, and we need a national plan to address Parkinson's, both research, care, diagnostics, the whole 9 yards. So what the national plan does is it establishes an advisory council of federal and non-federal members. That on the non-federal, they're all going to be people, experts in Parkinson's, including Parkinson's patients, caregivers, providers, researchers, and at the federal appointees will all have some role to play in the Parkinson's paradigm. So the advisory council will be established. They have 18 months, I believe it is, to issue a report to Congress highlighting what it believes Congress needs to be doing around research, care, prevention, and other activities. We've often had people ask, well, what do you expect to get out of this? What research dollar number are you hoping for? And our answer is, we're not trying to predetermine this. That's why we want to pull together the experts and really chart a roadmap. Another component of this is an annual research meeting. Currently, there are occasional meetings between groups like ours and the NIH, but there's no formal process by which all the agencies and nonprofits involved in research really get together and compare notes and chart a strategy forward to make sure that we're being efficient with dollars, both donor dollars and taxpayer dollars. So that's another important component. And then finally, this will require the Secretary of Health and Human Services to submit a report to Congress, also identifying level of research funding that needs to happen. And just to put it in perspective, with Alzheimer's, their research funding went from roughly $450 million a year to the most recent fiscal year, $3.8 billion. They've had a massive increase. And in the Parkinson's space, the federal government spends about 100 times more money caring for people with Parkinson's than they do researching the underlying disease. And we think that's got to be changed, significantly changed. I think we lost Leslie.
Oh, goodness. It seems like you have. So I'm going to jump in. I'm Rebecca Gilbert. I'm Chief Mission Officer here at APDA. Our next question is, lots of people have been asking, people who have a lived experience of Parkinson's disease, is this going to mean anything for me? I have Parkinson's right now. How's this bill going to help me?
Well, it's not a magic wand. It's, as Leslie pointed out, it's the first comprehensive federal approach to addressing Parkinson's. So it's not going to be an overnight project. It's going to take some time, but hopefully by pulling together all the resources of the federal government and the non-federal experts and nonprofits, we're going to be able to make greater progress. I'm sure that most of the people watching this know that last spring we announced the first biomarker for Parkinson's, which that could usher in new treatments and breakthroughs that we'd only dreamed about in the past. So we feel that the timing for the national plan is really perfect. We've had the biggest scientific breakthrough for Parkinson's. Now we need the federal government to, kick into gear and be a part of it. Where there could be some more immediate impact is around issues related to access to medications. One thing that Congress did that takes effect in 2025 is to cap out-of-pocket costs for Part D medicines at $2,000 a year. So it's not directly related to the national plan, but there is some relief on the way from an out-of-pocket cost. But I also wanted to stress that the National Plan Advisory Council is going to focus not only on research. It's going to focus on care models, caregivers, their needs. One of the offshoots of the Alzheimer's National Plan is that state and local governments stepped in and they came up with their own innovations and their own programs for the Alzheimer's community. And that was pretty much organic. So we're hopeful that that's going to happen with the Parkinson's community too.
Fantastic. So what's the timing of this? How soon will action take place? How soon will there be the council? How soon will there be benefits from this?
Yeah, well, there are a bunch of different dates, so I may look to my other screen momentarily to get it right. In terms of timing, the president has not yet received the bill. He's been traveling quite a bit, so it's a courtesy for Congress to hold on to legislation that it has passed and send it to the president when he's actually in town long enough to react to it. How a bill becomes a law reminder. Once the president receives legislation, he has 10 days, not including Sundays, to either sign or veto the bill. And so that's the timeline that we're working with. So we don't have a firm date on when the president's going to sign it. Like I said, he's been out of town quite a bit. But regardless, it'll be in the next couple of weeks, hopefully. I think the more important point is, what does it do? When does it actually kick off? We're going to push the Department of Health and Human Services. The secretary is responsible for making these appointments. We will push him to do that as expeditiously as possible. We don't want the advisory council, first meeting to be 9 months or 12 months from now. There's urgency to this. We had great involvement by the community, so we want to capitalize on that momentum and get things going quickly. So my hope is that the secretary and his team will put a plan together for nominating, federal officials and non-federal to this advisory council. In terms of some of the requirements, dates, there's an annual assessment of the National Parkinson's Project. And by the way, the National Plan and Parkinson's Act, that's the name of the legislation. But from here on in, it's going to be referred to the National Parkinson's Project. So within 2 years of the date of enactment, and then annually thereafter, there has to be an annual assessment of the Parkinson's Project. And within 2 years of enactment, there's got to be a scientific meeting, which I made reference to that. The advisory council is required by law to meet at least once every quarter for the first 2 years. And then after, and within 18 months of enactment of the bill, the advisory council will submit a report to Congress. And I keep saying enactment. So the House and the Senate have passed the bill. It becomes enacted once the president signs it. So we still have one more step. So in other words, the clock, these dates and months and everything I just referenced, the clock has not started to tick yet.
Excellent. Well, I think that Leslie may be back, in which case I'm going to be switched out for her. Hi, Leslie. Welcome back.
Hi, Rebecca. Thanks so much. And I apologize, Ted, but we're back in action here. Great. All right. So we just talked about the advisory council. And the next question is, how much funding will be put towards research versus other initiatives? How will the funding be allocated, and where does the money come from?
That is the million-dollar question that we don't have an answer to. One of the things that we put in this legislation was for the advisory council and the secretary to identify what they believe is a reasonable amount that the federal government should be investing in Parkinson's research. As I said earlier, currently the government spends about 100 times more on caring for people with PD, about $26 billion, versus what they spend on research, which is about $260 million. And so where those numbers end up, we're not certain at this point, but that's a big part of why we want this group of experts to come together to really chart out what is it going to take to make a mark, to slow the disease, hopefully one day cure the disease. We don't have any predetermined dollar figure in mind. And I will say that was a very common question by congressional offices. They figured this is a Trojan horse. You have a number in mind. What is it? Tell us now. We're like, no, we don't, because in some case, we could get $1 trillion tomorrow. And that doesn't mean that a cure is coming any faster because of the way research works and how it's iterative. And that's why every breakthrough that happens along the way, through funding by your organization, my organization, or the government, it all are additional baby steps toward new treatments.
Absolutely. And as we all know, if we could identify people early on and then have treatments, we may be in a situation where PD doesn't even raise its ugly head because we have nipped it in the bud. So, yeah.
Well, that's one of the hopes with the biomarker breakthrough, is that we're going to be able to identify people much earlier in the progression, possibly even before they're ever diagnosed, before they've lost the 70-80% of the dopamine. That could prove to be hugely beneficial. Another part of our strategy overall is around prevention of environmental risk factors, which is a topic for another day. But that is another very important facet of the policy work that we're doing. Absolutely.
And we're all behind you. So the next question we have is, how will the progress of this initiative be evaluated and measured? And how do we follow any updates regarding the national plan? What is our source for information?
Well, we will definitely be publishing information, and APDA and other members of the UPAC will publish information. With the National Alzheimer's Project Act, they actually have an entire listserv communication. So I'm assuming that the government will set up a listserv that anybody on this call will be able to sign up to get their messages. And through that, they communicate upcoming meetings, get information on alterations to their national plan. And so, we will be broadcasting this far and wide through our own channels, through our UPAC members, and through the government. One point that I want to make, though, is we need to make sure that the government does what it's been told to do. Sometimes things like this pass, everybody does their victory lap and says how great we are because we did this bill, and then they move on to something else. That's a recipe for failure. And so we are going to be keeping an eye on this, watching this, working with you and others to make sure that the federal government does what it's been told to do by Congress.
Right. The whole race isn't finished until we get to the end. And that's the point of advocacy, that we will be staying on top of that. And all the groups combined from UPAC will have their work cut out for them. You mentioned Alzheimer's disease. We know that a lot of research is connected sometimes in cross diseases or neurologic diseases, have things that may benefit Parkinson's disease research. Will this plan address the challenge of those with other forms of Parkinsonism besides PD, such as PSP or MSA or vascular Parkinsonism?
Yes, we very intentionally wrote that into the bill, much like we have written it into state Parkinson's disease registry legislation. We increasingly know that the disease is not monolithic. I mean, we've known that before, but we were certain to make sure that the law states not just Parkinson's, but atypical Parkinsonisms, including but not limited to the ones that you just mentioned, along with Lewy body disease and things of that nature. And we also wanted it to be not limited to, because there might be diseases out there that haven't been discovered or named, and we want to make sure that captures. Another point on this, though, is an evolving element of the scientific rigor and scientific enterprise is recognition that these diseases are not siloed. Alzheimer's is not siloed from Parkinson's, which is not siloed from Lewy body, for example. And so that's kind of, it's a bit of a shift in how people think, but we see that that we need to be taking a more holistic approach around disease research, because we could be missing the boat by not taking that broader view.
Came in, and as you know, you mentioned the economic burden of this disease, which is astronomical. So some of the questions we had are, what will the role of Medicare be in this national plan? And will the plan address issues of paying for things such as new medications, home care, PT, equipment, any therapy that could help someone with Parkinson's disease?
Well, again, this is going to be a report to Congress. So the advisory council does not have authority to implement any of what you just referenced. But the hope is that this report will provide comprehensive recommendations to the government on how to improve all of those items that were mentioned. I know physical therapy, physical, occupational, and speech therapy has been an issue through the years. Especially around the Medicare Improvement Standard, which we had to litigate against the Department of Health and Human Services to make sure that people weren't artificially denied physical therapy because they weren't getting better. It's like a fundamental lack of understanding of a disease. With Parkinson's, you're not going to get better; you're going to maintain. And there are a lot of diseases like that, including MS. So that being said, though, Medicare and Medicaid will have a seat at the table on this advisory council, because we feel that it's best to have them at the table, coming up with ideas and solutions, along with everybody else.
Great, thanks, Ted. So a lot of questions come in. This is a hot topic, as we all know, about the issue with the environmental toxins and the connection to PD. Will the plan address some of the new things that we're learning in this area? And also, if so, will the plan work to ban some of these toxins and environmental dangers that we're exposed to?
Well, the plan won't do that per se, but as anybody who's paid attention to our work over the last 8 years, we've been on a crusade to ban paraquat. And it hasn't been banned yet. We're still pressing the case. We will find out in January what the EPA's decision has been. But knowing of the environmental risk factors, we did make the EPA be one of the members of this advisory council. It took some explaining to do for people because it doesn't seem logical. But given that PCE, TCE, paraquat, rotenone, many other industrial chemicals have connections, have a correlation or connection to the disease, we felt it would be valuable to have them at the table as well. So again, the recommendations will hopefully include things like that. By eliminating these known environmental risk factors, we can eliminate a subset of the population getting the disease. I will note that the EPA has proposed, it has not finalized yet, but they have proposed a near total ban on trichloroethylene, TCE, which is heavily used in dry cleaners and other industrial uses. They've been given, I think they gave the Department of Defense and the space industry 10 years to implement the ban, but for all other purposes, it's supposed to be banned within a year. We're just waiting to hear from the feds or from the EPA for a final ruling on that. So you can tell the environmental risk factors are a major driver for me personally. I just think that That's the low-hanging fruit. Let's get rid of these things that we have control over.
It makes you question how the wheels of government work, at what speed they work. That's always an issue for sure. Great. We have a few additional questions here. One is about veterans, and were Veterans Affairs taken into account and consideration when the act was being developed?
Absolutely. In fact, we've really redoubled our efforts around veterans the last several years. 10 to 12% of all people with Parkinson's served in the military, which is a significant percentage, much higher than the general population. Years ago, Congress created a program called PODREX to provide specialized care and treatment for veterans in the United States. Over the years, though, while the veteran population increased by veteran with Parkinson's population increased by 37%, the budget for the PODREX was flat funded. So we made a major push. We convened an ad hoc veterans working group, including veterans and veterans organizations, which resulted in us making a major push to expand the funding for the PODREX and to add one or two more sites. So even in these extraordinarily austere federal budgetary times over the last 2 years, we've succeeded in getting a 74% increase in funding to the PODREX. And again, that has a lot to do with all the advocates that have, raised their hands and joined congressional meetings and things like that. I think anybody to hear that we got 74% increase over 2 years would think that's insane. You couldn't have. There's no way. Now, granted, the bar was pretty low to start with. It was only about 7 million. But this year we're pushing to get an increase up to, I think, 16 million. So yeah, veterans are very central.
And that's great. And you mentioned things that are personal to you. This is very personal to me. We have veterans in my family, but also family members who lived on Camp Lejeune for many, many years. So this is something of particular interest for me too.
Yeah.
Well, thank you for that. So let's switch gears a little bit. And, we at APDA and I know all of the PD organizations are very concerned about the historically underengaged communities, whether they're receiving programs and services, access to care, things, social determinants of health, also enrollment in clinical trials. We know this is a real challenge. So how did that play into the thinking and creation of the bill? And will this be something that will be implemented?
Yes, it's very important. And one provision of the bill basically says that the secretary's appointees have to be representative. We want experts, on the advisory council, but we want it representative of our population at large, because we don't want people left behind. I know that there are huge challenges, for all of our organizations in doing the outreach to underrepresented communities. And from our research perspective, I know that we do require some level of a DEI action plan, or how researchers going to reach out and incorporate minority voices. And we joined with APDA and Parkinson's Foundation a few years ago and submitted a report, a request for information to the then new Congressional Caucus on Social Determinants of Health. So we highlighted many of the factors that you're referring to in that. Because we believe all of our estimates, we believe, are underestimates in terms of the cost of the disease, the number of people living with the disease, because there are segments of the population that we're just not getting to. And by we, I don't mean the Fox Foundation, I mean society, all of our organizations, the government, and with some communities, there's a level of distrust that still has to be overcome.
Absolutely. It's a moral imperative for all of us. So our last question that we have here is about what do you need from us, from the Parkinson's community now, and how can people get involved? Because many people are ready to help.
That is a great question, and a wonderful one I like to get. When we started the national plan activity, I knew it would, resonate with the community, and we've more than tripled the number of advocates signed up to take action. So that's one thing. If you haven't signed up, sign up on our website to get our action alerts. We also have a training program to identify, recruit, and train advocates from that database to do congressional meetings. And we have held over 400 meetings about the national plan with congressional offices with 1,000 trained advocates. And believe me, that is a critical component, because the congressional offices can listen to us, but they don't care. They want to hear from their constituents and what impact this bill would have. So that was, to me, the shining star of this effort, was getting the kind of engagement for advocates. And ultimately, like I said, this is only going to be a success if we keep the pressure on, if we keep the HHS secretary focused on this national plan. And so we will count on advocates around the country to, attend town hall meetings, ask their member of Congress, how's the national plan going? Have you checked in with HHS? There are a lot of different things like that along the way, even before reports start coming out, to keep Parkinson's visible for lawmakers. I say, I've said many times in the past that one of the reasons Alzheimer's is successful is you cannot attend a public meeting with a public official without somebody bringing up Alzheimer's. And they don't necessarily have an ask. It might just be, my dad has Alzheimer's. This is the impact it's had on my mom and on the grandkids, whatever. Just tell your story and say, hey, will you do more for our community? Because they're going to say yes, and then you can go back at them when you do have an actual ask. But I think some people overcomplicate what it takes to be an advocate. It doesn't take much. It takes you and your story. And that is the most impactful piece, not facts and figures, but the story of how Parkinson's is impacting your life.
Right. It's sitting across from an elected official and telling your personal story. And I've seen that time and time again, that really, truly makes an impact for sure.
Yeah.
So thank you for that. So I think we're coming close to the end of our questions. I just wanted to thank you again, Ted. It was so great having you here. I apologize for the technical difficulties, but we were so glad you're here, and your talk was so informative to all of us. So this is really a significant step forward for the PD community, and we're so glad that all of you were able to join us today to make sense of all of this. And we here at APDA and all the Parkinson's groups are really optimistic about our future by this new law. But please remember that APDA is here for you now, every day, with the programs and services that can help you and your loved ones live life to the fullest. We know that every 6 minutes, a person in the United States receives a diagnosis of PD, and we are here for all of you. So to learn more about our programs and services, both those that are in person or virtual, please check us out. We provide these through our chapters and informational centers across the country. So if you contact us by calling us or emailing, we can help support you. Please remember you are not alone, and check out our contact details in the chat below. Thanks again, Ted, for joining us today. It was a pleasure for having you, and thank you to all for joining the conversation. Goodbye, be well, and have a great day. Thank you so much.